Stages of HIV infection.
HIV progression in adults is measured in 3 phases. Phase 1. In Phase 1, during the acute infection stage, the viral RNA molecules per milliliter of blood plasma may increase to more than 10 million during the first weeks of infection. The host immune responses will kick in to sharply decrease the viral numbers in blood plasma, and may lead to swollen lymph nodes, or the individual may continue to be asymptomatic.
Phase 2. During this phase, HIV replication continues at a low level and CD4+ T cells continues to decline. HIV symptoms are few, but a persistent infection such as yeast will be evident. Also, reactivated Epstein-Barr virus may appear in the form of oral hairy leukoplakia. Candida albicans, yeast, may occur in the mouth coating the tongue. It may also appear in the throat and vagina. Oral hairy leukoplakia are raised, painless white patches, or lesions that are located on the side of the tongue. An individual may also develop other symptoms such as increased temperature, diarrhea, or shingles as further indications of declining immunity. Phase 3. When an individual enters Phase 3, they will most likely be showing signs of AIDS, such as low CD4+ T cells of 200 cells per microliter, severe fatigue, cytomegalovirus I infections, and chronic diarrhea. They will also develop yeast infections of the trachea, bronchi, or lungs. Additionally, they may develop tuberculosis, pneumocystis pneumonia, Kaposi's sarcoma, and toxoplasmosis of the brain. At this stage, if the individual continues to be untreated, they are at risk of dying from development of one of these opportunistic infections. This progression of phases 1 through 3 would take approximately 10 years in a person that is untreated. The reason for knowing which phase a patient may be in is to adequately treat them with certain antiretroviral medications according to treatment guidelines and to know whether they have HIV or AIDS. A brief word about HIV subtypes. The subtypes of HIV are HIV-1 and HIV-2. The majority of HIV cases around the world is HIV-1, which accounts for approximately 99% of cases, which is then subdivided into Group M, majority. To make matters more complicated, Group M has subtypes that are further lettered, such as subtype B and subtype C, and there is approximately 9 of them. HIV-2 occurs mostly in West Africa, but may show up in other areas of the world. HIV-2 asymptomatic period is longer and it has a lower mortality rate and lower virus load. If you have questions about HIV, please contact your health provider. Thank you for watching.